Hey guys, what's going on? Sherman here. I've gotten a few requests to do an IFAK update. IFAK stands for Individual First-Aid Kit. So this is my individual first aid kit that I carry with me in my EDC pack. This is the VanQuest 4x6 Fat Pack. I recently reviewed this and a couple of other videos about it. And I briefly showed off the contents and told you guys I'll do a kind of a loadout video if you wanted, and I've gotten some good feedback on it, so I thought I'd go ahead and do it now. Now, I just want to say before I get into this video that this is not the perfect kit. An IFAK is just that. It's an individual's first aid kit. So mine is going to be a little bit different than yours, and it's supposed to be that way. There is no one great IFAK that is better than any other necessarily. Different IFAKs are better suited for different situations. They're suited for different people. They're suited for different environments, different times of year, etc. So I just wanted to bring that up just right off the bat to hopefully avoid some of the comments like, why didn't you have this? Why don't you have this in your kit? Or why do you have that in your kit? You should have this. Well, you know, the things I have in here I see as necessary. They work for me. There may be some things in here that are missing or some things that I would like to add but just haven't yet. And there may be some things in here that are unnecessary and I'll never use. But this isn't a show and tell or anything like that about, you know, what I need to have in here or what I should have in here. This is what I do have in here at this particular moment. Like I said, everything's subject to change. I'm constantly changing up my gear, how I carry it. You know, I'm constantly changing my first aid kits and my trauma kits. You know, because I'll learn what works for me and what doesn't. So all suggestions and recommendations are welcomed, guys. I don't want you to think that. I don't want to be off-putting. I just want to try to avoid the, you know, why don't you have this instead comments. You know, I've gotten those before. So, but anyway, I updated the patch. This is actually one that I made. It's a reflective medical cross. That's made of a reflective material. Just put that on there instead of that janky ratchet first aid patch that I had on there before. I may throw in a better patch, you know, sooner or soon, but that's what I have on there now. But anyway, nothing really on the outside except for the carabiner, which helps me pull it open as I showed my review. I don't have medical shears on here. And also, if there's anything missing from here, I have on my trauma kit. I carry a trauma kit and an IFAK in my EDC bag. If you're wondering what the difference is, I'll save the details for a further video. Basically though, the difference is an IFAK is for things like cuts, scrapes, burns, things like that. Your trauma kit is going to be for major puncture wounds, gunshot wounds, stab wounds, cuts, etc. It's for your heavy trauma. It's for the stuff that you need immediately, or else you're going to bleed out and possibly die. So this is the stuff where you get a paper cut or you cut your finger on a knife. It's just annoying. It's bleeding. You need to cover it up. Or you have a headache. You need to get an aspirin or whatever. So that's the difference. So no, I don't have quick clot in here. I don't have a tourniquet. I don't have shears. That stuff's in my trauma kit, which has stayed the same for over a year now, so I probably won't do an update video on that. Anywho, I'm sure I'm going to get a ton of comments of, you know, to see the video, skip to whatever. But anyway, just going to open it up and show you guys. Alright, so this is what I got going on. One alteration I made, well, I think I showed this in my review, is I had this piece of paracord that I looped over and I burned right there at the seam. I'm going to zoom in a little bit or lower the camera down just a little bit. And the reason I did that is so that I can have a roll of medical tape. This is 3M Transport tape. Super sticky. It sticks to wet and bloody surfaces pretty well from what I understand. And from my experience, this is what I used when I cut my knee open throwing a knife at a tree. So a lot of you guys know that story. Anywho, I did that and I made it long enough to where it can fold up inside here without getting in the way. But also, when I'm opening this up and I'm using it, this will never leave the bag. You know, you want your tape at the ready. Tape is a very important component in your first aid pack. I may tell the story of cutting my knee open, but you know, one of the things I used the most was tape. It's, you know, you need it to secure those bandages especially on, you know, hard to secure places. But anyway, I made it long enough to where I can just kind of flop out to the side here, where it'll stay out of my way when I'm trying to get to certain things, but it's also always right here. It's never far away. And also you can, it helps you unroll the tape too when it's sitting there. You know, it's almost like on a tape dispenser. So I recommend this. If you can do this on your packs, I recommend it. It really works for me anyway. So I just have that attached to the elastic band there with a small Night Eyes S-beaner. It's like the number 1 S-beaner. I'm not going to take it off. I'm just going to leave it on there. First of all, on this little ladder area right here, as it's quaintly called, I have a pair of the deer and tick, or the tick and leech tweezers from County Com. Has an NSN number. You can see. These are my favorite tweezers that I've ever owned. I absolutely love these tweezers. Somebody, I forget who it was, some general of the Army, or maybe it's a commandant of the Marine Corps. I can't remember who it was, but somebody went on and had a statement about these that said these were the only tweezers worth a damn, or something like that. But these things are great. I've not done a review on these just because they're tweezers. I can do a review if you guys want. But these are they're small, they're just so precise, needle precision. And you really can't tell. I don't know how close I can get here. But there you go. They're serrated. So they have those serrations. Great for getting splinters out, which is really all I use this for. I don't travel around in the swamp. I don't have to worry about leeches. We do have ticks here in Georgia. I've never had one on me, thank God, but you know, I would be kind of nervous trying to attempt to pick one off. But I use these for splinters. These tweezers are awesome. I have a bottle of eye drops. These are just pretty much, you know, the plain. They're non-medicated, I don't think. It's just sterile eye drops, basically saline solution, like eye rehydration. You know, very inexpensive. You can see Family Dollar. It's like $1. Super inexpensive. Very compact though. It fits in here perfectly. Here again, it's an IFAK. This is a boo-boo kit. So I know some people would comment, oh, you know, you don't need to worry about your eyes. You need quick clot deterrent kit. But, you know, that's in my trauma kit. So if you get, you know, sawdust, I've gotten sawdust in my eyes a bunch. Use this. You know, when I'm sanding different stuff, metal shavings flying around, or, you know, get anything in your eye. It's a really good thing to have around. And this also works really well at a wound wash. If you get the one that's pure sterile saline, works really well as a wound wash. Some Advil, which is ibuprofen. I prefer ibuprofen for pain relief. I don't like using aspirin. Acetaminophen's okay. I just prefer ibuprofen. That's what I have in here. But I also have Tylenol, which is acetaminophen. So I have that on there as well. So I have both. Some people prefer one or the other. Well, and I just, you know, have 2 different pain reliever options. Right here is just a small roll of gauze in a sterile packaging. This is a 3 by 3 inch, 4 yards. So just good to have on hand. Just a little small roll of gauze. Nothing too extreme. Like I said, saving that for the trauma kit. So that's all I have in there. Because you're kind of limited to what you can put in this small 4x6 fat pack, just because of the length. So you can see pill bottles are perfect. Anything longer than these pill bottles, and you're going to worry about you know, infringing on the space. You have to zip it up. You know, if it comes out past the zipper track, obviously you're not going to be able to zip this thing up. So, and little baggies here loose, kind of underneath everything here in the bottom. Benadryl. I think this is I think it's like a anti-diarrhea medication. Don't you love it how I have stuff in here I don't even remember what it is? That's why it is really good to go through your gear, guys. Yeah. Yep, anti-diarrheal. That's what I thought it was. And also, guys, a really important thing is to go through your IFAKs, your trauma kits every now and then. So stuff like this. I forgot that I had this in here because it's just kind of hanging out at the bottom. I don't frequently have diarrhea, so I don't access these frequently. So they just kind of hang out here in the bottom, just, you know, in case you need it. Because here again, when you need something like that, you really need it. But it's good to go through your IFAKs and your trauma kits regularly. or every now and then at least, just to remember what you have in there and to check to make sure, to see if things are expired. While I'm at it, I'll probably do the same thing, take inventory. That's really important. Down here, tucked away at the bottom, perfect little spot, Neosporin. Just a little tip, guys, from when you're doing your first aid kits and whatnot. When you get these tubes in Neosporin, they come in these like plastic toothpaste-like tubes, or any of your triple antibiotic ointments. They're going to come, and the tips of these are going to be very, very sharp. It's surprisingly how sharp these things are. Take a pair of scissors and just cut at a perfect, like a 45-degree angle, and then keep cutting until you round off those edges. That's mainly for if you have these in a plastic bag, you won't rip the bag wide open. Or if you keep it stored in your gear, just those hard, sharp plastic edges over time will wear into and dig into your nylon gear and break it down over time. So this will help save your gear, save your plastic bags you're keeping this in. It's just a handy little tip that I learned from YouTube. So just wanted to pass that on. In these two pockets right here, you can see I have two pairs of gloves. These things are great. These are Black Talon gloves by Rescue Essentials. I believe they're affiliated with North American Rescue, but these are black nitrile gloves. These are slightly thicker than normal nitrile gloves like you get at the drugstore or Walmart. You can get the big box of nitrile gloves. Why nitrile? Or nitrile, however you want to pronounce it. Because a lot of people are allergic to latex. I don't think nitrile is an allergen. I haven't heard of anybody allergic to it. Maybe there are some. But that's very important, guys, because your first aid kit isn't just for you. Or it shouldn't be, anyway, in my opinion. If you're going to carry something like this, you should be willing to help somebody nearby. You got to help your fellow man. So obviously you don't know what they have, and your hands are dirty. You're attending to a wound. You're going to want to keep your dirty hands covered up and also keep their dirty pathogens, bloodborne pathogens, off of your hands. So very important to have gloves. It is one of the most important things in any IFAK and trauma kit. Obviously, if it's an emergency and you don't have time, saving somebody's life is more important, But if you have the time, definitely worth it. And here is just a small pair of curved scissors. These are also from County-Com. These are the Maritac brand. Absolutely love these scissors. Stainless steel. You can get them in a bunch of different colors. I have a green pair as well. But these scissors are very smooth, and they're super sharp, and they're curved. So these aren't going to be cutting clothes off anybody. But what I put these in here for is for cutting. If you have to cut a bandage, perfect for that. Or anything of the sort. Okay, in this front elastic loop part, I have my baggie of Band-Aids. So, by the way, you can get these bags at Walmart. You can get them like over in the jewelry section. They're jewelry bags, and you can get a pack of 300 of these, and they're pretty thick. These aren't like sandwich bags. These are not like, these are more like the heavy-duty freezer Ziploc bags. They're real thick mill, and you can get them in all kinds of different sizes. So hit up Walmart or any kind of craft store that has a jewelry section. That's where you're going to find these nice bags. And that's where I go, and that's what I get to put all my medical supplies in. Just because, like I said, they're thicker than average plastic bags, and you can get them in the convenient sizes, and you can get like 300 of them for just a few bucks. So it's a great deal. Anywho, in here I just have assorted size bandages. Just knuckle bandages, butterfly closures. Those are some of the finger condoms. Those are for, if you cut your finger open, slide that on over your finger, keeps it protected. And, for a knife guy, that's a pretty important thing. One thing I would love to add to this kit, however, and I've seen these before, but it's not something you can get in just your average grocery store medical section or pharmacy, and that's a finger tourniquet. It's a special tourniquet just for your fingers, and that's awesome for us knife guys. So I might want to look into getting one of those, because it's not necessarily a trauma, depending on what finger you cut off. You can bleed out from cutting your finger off for sure, or maybe not bleed out, but get some good bleeding done. In this side pocket, some Q-tips for applying the Neosporin because you don't necessarily want to, if somebody cuts their finger open, or even you don't want to take that cap off and smear it on your wound, because then you're getting that bacteria, you're getting your blood down into the bottle, and it may be okay because it is an antiseptic, so it may be nothing may be able to live in it. I'm not 100% sure, but it's gross to think about. So if you have the time, it's nice to apply a Q-tip, and so you don't have to dip the tip down in your wound. But also, it's good for scrubbing out wounds. So that's really the main reason I have these on here, for scrubbing out. Have a couple of Bare Aspirin. These are the low milligram, and as you can see here, these are actually expired. So that's, here again, it's really important to go through and take inventory. Now these will still work, they just won't be as effective. But these are the 81 milligram baby aspirins. These are what you're going to want to give somebody if they think they're having a heart attack. Obviously, call an ambulance or take them to the hospital. But make somebody chew these up. Give them one, tell them to chew it up. And there are hundreds and hundreds of testimonials about people that are suffering or having a heart attack, chewing on an 81 milligram Bare Aspirin, and they're okay. It actually, because it opens up, it expands your blood vessels, because it's a thinner, it's a blood thinner. So it prevents clotting. So just a little tidbit of information if you guys didn't know. Got a couple of Tums in here just for, stomach ache. I don't usually have stomach aches. Like I said, everything in here isn't just for me. And this part over here, got some antibiotic ointment, or I'm sorry, sunscreen lotion. I thought that was antibiotic ointment. I bet I put that in here by accident. But anyway, sunscreen. These are pretty cool. These are Splinter Out by, see there, is it MediPoint? Yeah, MediPoint. I'm not going to open one up, but these are in little sterile packages. And basically what it is a very, very thin, looks like a little metal ribbon. And it comes to a needle tip. So it looks like that, basically. And what that is used for is digging out splinters. These are sterile. Now it's just in paper, it's not in a plastic, so maybe it's not, the sterility isn't great. Heat them up with a lighter though. But anywho, because just tweezers are only going to be good for picking the splinter out once it's already on the surface of your skin. But I've had metal splinters before, which suck. Wood splinters I can deal with a little bit better, but metal splinters or glass splinters, they suck. And I've had them a couple of times. These are really, really good for digging them out. So you don't have to carry like a sewing needle in your kit. Get some of these. I'm not sure where you can get them. I got this from a medical kit at work. I had never seen these before, but try to look those up. Those are a really good product. I've used them before. A couple other people I've given them to have used them, so they work great. And this back pocket here is just a larger gauze dressing. This is a non-stick pad, so that's kind of what you're going to want for your wounds. I got two of them in here. Do have some Celox. Celox is a blood clotting powder. Very much like Quick Clot. It's going to work the same way, but this is in powder form, so you rip this open and pour it on top of the wound, or sprinkle it, like you're seasoning something. It's going to help. So just I mean, it's just a small bag. It's just for minor lacerations or punctured wounds that just won't stop bleeding. It is a little blood barrier hemostat gauze. Very thin. I've never personally used these. A lot of people I know, though, use these for nosebleeds and say they work great. So you can get these from Walgreens. I think these are like $1 a piece. So I stocked up on them at one point. These things are one of the most valuable pieces in my kit. I've used these things so much. It's one of those things I never thought I would. But anyway, it's Tegaderm. Tegaderm's made by 3M. You can get these in a box of, I think, 10 off Amazon. And you can get these at most pharmacies. Just look for Tegaderm. These are the smaller sized ones. 2-inch, yeah, they're 2 3/4 by 2 3/4 inches. Is that it? Yeah. Basically, I'm not going to open it up to show you guys because these are kind of pricey. For a box of 10, you're going to spend about $8. So almost $1 a piece. But anyway, what it is a basically sterile adhesive saran wrap. It's just it's almost 3 by 3 inch saran wrap square that is adhesive. So what this is good for, like when I had to get my stitches, they told me not to get them wet. So really I didn't have many options. When I needed to shower, I could have just wrapped my leg in saran wrap, but they actually gave me some Tegaderm, and I already had some. So what I would do is I'd put a small patch of gauze over just right over my stitches, and put that film right over that, and it sealed it in and kept all the moisture off of my wound. So that's what these are really good for, is keeping your wounds clean and dry. When it's like a really sensitive type wound, you don't really want to put a Band-Aid over it, and that's not, you know, water or airtight anyway. But of course, you can do a bunch of other things with Tegaderm. Tegaderm's great. Definitely check these out, and you can see they're super small. Throw them in your kit. It's a really good piece of gear for your first aid kits. Not going to really do much in the world of trauma, but for first aid, works great. Like I said, worked great for me anyway. And I believe that's it. No, there's a couple more things in here, but it's just in this pocket. I have a triangular bandage. These things are kind of like the duct tape of the medical world. You can use these for a multitude of different things. You can use these as, of course, you know, gauze wrap. You know, you can use this to try to control bleeding. You can use these as a tourniquet. You can use these as a sling if you like dislocate your arm or anything like that, which I've done. It sucks terribly. So, and that's why it also has safety pins to help with that. You can soak this in water and cover somebody's head if they're suffering from heat exhaustion, or wrap it around their neck to keep them cool. Just a bunch of different things, and they're pretty compact. So, I mean, it's not sterile, so you may not want to add this directly to a wound. And obviously, put gauze over a wound. You can use this to wrap it, use it as like a compression bandage. Works great. So that's very important to have. I would have put like an ACE bandage in here, but I didn't really have the room. That's in my trauma kit anyway. So those front pockets, that's it. I do have a couple more goodies in here actually. What else do I have in here? Okay, here's all my different ointments. Have a thing of burn gel by Water Gel. This stuff's really good burn gel. You don't want to put this though on like really bad second degree or certainly not third degree burns. You're going to want to go to the hospital. You don't want to put anything on an open sore burn, because you know I've had EMTs tell me this before. Just you know, when we were talking and whatnot, you don't want to really put burn gel on a bad burn that you need to go to the hospital for, because the doctor's going to have to scrape that gel out of your wound to clean it anyway. So it's really not going to do any good. This is going to be for your small burns you get on your finger, like from a lighter, just you know whatnot. It's basically kind of like glorified aloe. If you have a sunburn, put this on your burn. It's going to relieve the pain a little bit. So I have some more Bear aspirin. I don't know if this one's expired. Let's see. It is also expired, but redundancy. A little single serving size. Triple antibiotic ointment. Here again, a little single serving packet. A little Fight Club reference there. And some hydrocortisone cream for itching. Like I said, guys, not the end-all kit. This is not the kit above all other kits in the world. This is just my personal first aid kit that I use. I don't use it on a daily basis, but I have it with me on a daily basis, and I have used it quite often. So this is what works for me. This is really the extent of the items I'm going to really need to use for the kind of injuries that I'm going to have. Any other kind of injury, you know, I'm going to want to go to the doctor or the hospital for. You know, when I had to get stitches, that's something that obviously you're not going to want to do yourself. So the only thing that I could do was control the bleeding until I could get to urgent care. This is just my kit. This is what works for me, like I said. I'm sure there's a couple other things. There's a couple other things I would like to add to this and change out, but this is what I found works for me so far, guys. I hope you guys enjoyed this video. Like I said, if you have any friendly recommendations, I'd love to hear them. I'd love to hear about your system and your kits. Do a video in response to this one. I know you can't do video responses in videos anymore, But, you know, make a video and then send me the link in a comment or something. You know, I'd love to see your kit. But anyway, like I said, if you have any questions on where I got some of this stuff or, you know, suggestions, anything like that, just let me know, guys. But I hope you enjoyed the video. Hope everybody has a great rest of their night. Stay safe, stay sharp, and God bless. Sherman 614, peace.